All right, it is 5 o'clock. I would like to call the meeting to order. I want to once again thank all of you for your continued efforts and energy putting into these meetings. It's greatly appreciated. I would like to invite you to join me in centering our conversations tonight. To begin with, I'm going to read a statement, and then I will ask you to join me in a breathing exercise to help bring focus and thoughtfulness to the conversations we have.
Metzler.
Join the meeting.
That's interesting. All right. So today we convene to listen and learn from each other through reflection and discussion. As we reevaluate and improve our public safety practices, we elevate the voices and experiences of the communities who have been and continue to be disproportionately impacted by inequitable systems. We thank all of those of you who have advocated and worked on dismantling injustices in Tigard and in our broader community. We build up their efforts to create more equitable and just outcomes for people of all backgrounds and abilities. The purpose of our meetings is to develop our understanding of current public safety structure and procedures, to identify and eliminate institutional racism within Tigard's public institutions by centering equity and racial justice, to bring forward the concerns and experiences of ourselves and our community, and to bring recommendations to city leadership to improve the lived experiences of all people in Tigard. Now I'd like to have you join me in a breathing exercise. You're welcome to turn off your cameras for this section. Please close your eyes and gaze softly downward. Feel the chair under your legs. Breathe in deeply through your nose and out your mouth. Feel your hands in your lap. Breathe in deeply through your nose and out your mouth. Feel your feet on the ground. Breathe in deeply through your nose and out your mouth. Slowly open your eyes and begin to breathe normally. Thank you all for participating and creating space with me. Kim, are you ready to do the roll call?
I am. Thank you, Patty. Kenny McDonald.
Here.
Officer Nunn. Oh, no. Shelby Rahala.
Here.
Michael O'Brien.
Here.
Elise Butera. Emilio Calderon. Liz Newton.
Here, but I have to jump off at 5:45 for the budget committee meeting. Sorry.
Thank you. John Trin.
Present.
Jimmy Brown.
Here.
Landers. Lee Lofgren.
I'm here.
Justin Lowe. Danny Rauda.
Here.
Valerie Sasaki. Here. Sean Stoldryer.
Here.
Nick Farmer. And Jeff Mott.
Here.
And that's roll, Patty.
All right, thank you.
Patty, excuse me for a second. Could I just add that Judge Oberdorfer is listening in, but because the first session involving the public comment is something that might conceivably go to court at some point, I will text her after that discussion is over, and then she can join in and be available for questions. Thanks.
All right, thank you, Judge. So Kim, do we have public comment this evening?
We do. I'm letting Mr. Pot off. He's rejoining us this evening. I think I said this in the email, but Mr. Potoff this evening is going to have 3 minutes, strictly time kept. And then if there are any clarifying questions that folks have, we'll be taking those offline and we'll get you those answers separately from this meeting. Mr. Potoff, are you with us? You might be muted.
Yes, thank you. I'm here.
Oh, great.
Hey, welcome. I want to welcome Mr. Potoff to our meeting, and I want to thank you for taking time to speak to this Public Safety Advisory Board. Your comments are vital to the board's mission. As Kim said, you're limited to 3 minutes, and all comments need to include your full name and address just for the record. All right, thank you.
Thank you. My name is Roger Potoff. I live at 11710 Southwest Ann Street. And I want to make a clarification because in the photo that I sent of the abandoned home, it must have been the muscle memory in my fingers led me to type in my own address as the abandoned home. And the address of that abandoned home is 11770 Southwest Ann. And that is the neighbor immediately to the west of our home. And I hope that you've had an opportunity to look at the photos that I included for that abandoned home. And you may also recall that my comments back in early April also related to an incident that originated with the then occupant of that home. And I just want to begin with a quick prepared remark here. And that is to say that it is the, let me find my place here. It is the right and duty of the citizens of Tigard, of this community, to participate in the thoughtful reflection, deliberation, articulation, and correction of the laws and regulations and the purposive values in which they are or should be rooted. And in what little time remains, I want to also now quote from a poem from Amanda Gorman, who is the National Youth Poet Laureate who spoke at the Biden inauguration. Just a quick excerpt. She writes, "Our goal is never revenge, just restoration, not dominance, just dignity, not fear, just justice." And that moves me to this comment. My wife and I envision a neighborhood that is safe, reflective, not flawless, but not lawless. We stand on the solid foundation of our labors. Our word for this is home. We shall not lay down these labors of love and hope. We humbly promise this to ourselves, to each other, and to our neighbors. And that really, I think, concludes my comments. I will, I ask you to take a close look at the photos, particularly for this abandoned home, because it's not hard to imagine somebody taking that place over, whether to burglarize their way in, to do drugs inside of it, but it is completely abandoned. And it's an abomination.
Thank you very much for your comments this evening, Mr. Potoff. We really appreciate you coming. Patty?
Yes, thank you. Thank you, Kim.
And we've sent your photos to the board. And if we have any follow-up questions, they will be routed to you through the city. Thank you so much.
Yes.
Thank you.
All right. So at this point in time, I'd like to welcome Chief Mcalpine to give her update to the board. Is it possible it's Commander McDonald?
I don't think she was going to be here, but did she have any? Did she have a special note that she put on there, Kim? That
she did. She was going to talk about the budget updates.
Oh, the budget update. The budget is in process. Tonight is will be the third and final scheduled budget hearing for this year, and I suppose that if it doesn't get finished tonight to be voted on by the budget committee, then it could go to an additional meeting, but that would be something they would have to decide on tonight. So
Yeah, I think specifically she was going to talk about the two PSAB recommendations that are in the budget.
Yes, so the professional standards sergeant and the community navigator, are those the two that she was?
No, it's a 40 hours of training.
Oh yeah, 40 hours, sorry, because we're already working on that. Yeah, we've already tried to start incorporating the 40 hours of training, so I kind of forgot about that. So Sergeant Prater, who you all know, is our professional standard sergeant, but he's also in charge of that training section. So Jared is working on the implementation of adding that additional training into our annual training calendar and get that additional 40 hours of training in there. And additionally, the position that he currently occupies under kind of a pilot program is also something that's in the requested budget. And so I guess the best I can let you know about that is that so far the budget committee hasn't really had very many questions about. I haven't actually had any questions about that to this point in the process. So I don't know if that'll change this evening or not. I'll be here with all of you. So the chief will be at the budget hearing with Councilor Newton and everyone else from the budget committee.
And Liz, I see your hand.
Yeah, I just want to follow up on Commander McDonald's comments. I think that the recommendations of the PSAB have been well received. I think the evaluation of the community navigator, and my understanding, there was no real questions about that. So unless something happens tonight that I don't foresee, we've got some other things we're talking about. I think that will go through. The other thing that we're going to talk about tonight that's going to be interesting is some increased resources to look at clearing homeless camps when it's warranted. And I think we're going to have a discussion about, it's not about removing people without compassion, but when homeless camps become, in the eyes of the people at Just Compassion or our CSO or our officers or the folks that try to bring resources to those people, when they become unsafe, we need to look at a way to try to address those concerns. And so I think we're going to be looking at providing some funding for that. Again, it's not wholesale, just removing people, but giving the community the resources to not only, clear up those camps if necessary, but try to bridge those folks to getting resources that are needed. So there'll be a discussion about that tonight as well. It'll be towards the later in the meeting, so you might be able to jump on when you're done here, but we'll keep you posted. So that's something that's going to come up tonight. We're looking at providing more resources for that. Is that reflective, honestly, you think, Jamie, of what we're going to be doing tonight on that?
Yeah, for sure. I mean, that's that critical piece, is that support system for those that are houseless, is trying to come up with some sort of a have that support network that's available so that they can avoid falling back into that same situation that they're currently in. So that's a critical component. Yes. And that's exactly the discussion that I was hearing. And that's part of that piece, is trying to identify that.
Thank you. And Sean, please.
Liz, I'm glad to hear. I'm glad to hear the city's working on that. I've actually, just in the people I know in my circles, I've heard a lot of concern about that, and I'm not going to share any of the stories I've heard at this moment, but some of it's pretty serious. I guess, is the city working with like the city of Portland and Portland Metro? I had heard there's a big development of tiny houses for this going in south of Multnomah Village. Do you know anything about that?
We're working with Washington County, and Community Service Officer Brandon Peterson, who's our link to our houseless population, actually, is my understanding, is going to tour that facility in Multnomah Village. And one of the things that's in this package to address houselessness is some funds to identify the possibility of locating a pallet community, if you will. That's what I'll call it, in Tigard. So we've got a lot of things that we're trying to do to get people the resources they need, keep them safe. I worry about that. There are some situations that just flat out aren't very safe that they're in. And so that's my worry. But anyway, so that's in that proposal as well. So yes, we're looking at doing something like that here.
Okay, hopefully that includes some sanitary restroom facilities as well. That's really big
The
deal.
safe parking lots, looking at all those different, I know our community development department is looking at all kinds of ways for affordable housing. So we're trying to be thoughtful, but also try to address it on as many different fronts as we can, but thoughtfully, not just not just scattergun, but try to thoughtfully address how we can address this issue and help these folks.
Thank you.
Thanks, Liz. Thanks, Sean. And John, please. Oh, you're muted.
Thank you. Yeah, I just want to follow up with the last comment that the Metro bond passed a few years ago, I want to say between 4 or 6 years ago, which allocated some more resources for the bricks and mortar of building more affordable housing within the Portland metro area. Metro allocate those funds out to each counties to manage and work on development. And so I think right now the housing department of Washington County is in charge of getting those dollars out and working with providers and developer and for the affordable housing. And I think also within the last couple of years or 2 or 3 years that they also passed some services dollar to help with services to provide to the houses, individuals struggling to find homes and shelters. And so I think the best resources, if you want more information, will be the Washington County website under the housing department.
Thanks, John. And Commander, it seems like John, still your comment? Okay, great.
John said almost word for word what I would say. Yep. He and I have had that conversation in the past. So yeah.
Any other follow-up for the Chief's update?
All right. Well, thank you, everyone, for your comments. All right. At this point, Kim, are you going to be facilitating the discussion of the mental health first response recommendation?
Yes, I was going to lay out kind of our roadmap for the evening, make sure everybody's kind of on board. We'll start with Jeff Mott. He's put together a great presentation on his recommendation, so he'll take it away and give us his rundown. We've asked John Trin as the licensed mental health professional on the board to give his comments following Jeff's presentation. Then we'll open it up to the board for any clarifying questions or comments that you have for Jeff and John. And then we'll go into breakout rooms for the bulk of this evening and then come back together as a group to discuss the recommendation and potentially vote on it this evening. If we don't find a conclusion tonight, we do have times reserved in our follow-up meeting. Does that sound good to everybody?
Thank you, Kim. Yes, sounds great.
Great. So Jeff, either Tammy can pull up your presentation or if you have it ready.
I have it ready. Thank you. Just give me a thumbs up if you see it. All good? Did that still work? Yes. Okay. Fantastic. So thanks for the time. I think this presentation will probably just take 15, 20 minutes. As you know, we can see from just the discussion we just had, mental health first response and addressing houselessness is still a big need in Tigard. And this recommendation could help provide another prong in the infrastructure to address resources and the need. So I guess we'll talk through just the recommendation and maybe some of you had a chance to look at the presentation before the meeting, but wanted to kind of focus and center everybody's head as I take you through the details. So then we'll get into current examples, why we have a need for a first response team, the benefits of this, and then what the city's infrastructure could look like, the response infrastructure. And then as Kim said, John will talk and we'll go through breakout rooms. So here we go. And I don't want to read it, but I'll probably just read it. Establish a Tigard or South Cities mental health first response team to serve community members during nonviolent mental health related situations, including but not limited to conflict resolution, welfare checks, substance abuse, and suicide threats. with a focus on service, care, and providing resources. This team would rely on trauma-informed de-escalation and harm reduction techniques and would operate in tandem with the existing South Cities mental health response team. So I want to stop on that point because the idea of this first response team isn't new. Eugene has Cahoots. There's big cities across the country that have teams like this, medium-sized cities, as you'll see on the next slide. But this isn't looking to replace the existing great work that the Washington County Mental Health Response Team has done, or the South Cities Mental Health Response Team. This would be an add-on to that infrastructure. The second part of the recommendation is just more around timing. Mental Health First Response Team would to be established within 1 year of recommendation approval and to expand during a 3 to 5 year period with the goal of utilizing crisis worker and medic pairs to respond to these interactions instead of police officers. So any just questions on the language? Anything, was anything not clear before I move on?
I don't see any hands.
Okay, cool. So in the past, when we've talked about first response teams or street response teams, we've talked a lot about big cities having them, San Francisco, Portland. These cities are medium-sized, I'd say, and have first response teams. So we all have heard of Cahoots in Eugene, Springfield. They utilize a crisis worker and medic pair. They actually respond to about 17% of total calls in Eugene, which is incredibly similar to Tigard Police Department's percentage of BHI interactions. I think it's 17% also for Tigard. Weird coincidence. Albany, New York, population under 100,000, has a similar program called Accord. It's a social worker and a paramedic pair. Birmingham, Alabama, a little bit bigger. They utilize crisis centers and a specialized mental health hotline, 988. And then on the right, just to show the population of South Cities, we're at 110,000, give or take. And so why? Almost 20% of Tigard interactions include a behavioral health or a transient component. And our local resources for mental health are fantastic, but they're limited. We have the Washington County mental health team and the South Cities mental health team. The South Cities, of course, on the 2-week rotation across Tigard, Tualatin, and Sherwood. So really for 4 weeks out of 6, we don't have on the street all the time responses. So our police officers have to respond to these interactions. The problem with that potentially is that fatal law enforcement incidents disproportionately include an individual in mental health crisis. And we absolutely want to avoid that. That number comes from a November 2016 study published in the American Journal of Preventative Medicine. They estimated that between 20 and 50% of fatal encounters with law enforcement involved an individual in mental health crisis. The last thing, between 20 and 25% of reported property crimes in Tigard are cleared each year. And just the language between that, you have reported crimes and then cleared crimes. And Commander McDonald, correct me if I'm wrong, but basically you have the information to make an arrest, you've made an arrest. Basically the crime is taken care of and we figured out who did it, to put it in my non-expert wording. And the reason that's, okay, cool, thank you. The reason that's on this slide, I'll get to in a second. So the benefits, the service is really for the community, right? The personnel would be potentially a crisis worker with several years of experience in the mental health field. The difference between the existing mental health response team and this team would be mental health response team is like doctorate level education. This person would have several years of experience, but doesn't have to be a doctor, and then a nurse or an EMT. Long-term, there's the potential for all around coverage, 24/7, 365. And we kind of went through in the recommendation what kinds of services they would provide, but anything from crisis counseling to substance abuse, resource connection and referrals, transportation to services in certain cases. And this isn't new either. A lot of this is just is looking at what Cahoots in Eugene is providing. The benefits for the department and for the city are cost savings and time. And I did some digging online. I was like proud of myself doing some algebra to figure out how to get to these numbers. But based on the Tigard police budget and the number of interactions per year, and this number, what's it from? 2020, $643 per interaction. That is less than Eugene, just for some reference. It's like $150, $200 less than Eugene. But Cahoots in Eugene, the cost per interaction is $65. And you can see it's a huge difference. So if the number for potential savings is basically if all BHI interactions were taken care of by a first response team instead of the Tigard Police Department, it would be almost a $2 million savings per year. And then getting to time, this is why the clearance rate was on the last slide. It's 140 hours on average per month that the Tigard Police Department invests in calls that potentially could be serviced by a first response team. So instead of servicing BHI interactions, nonviolent BHI interactions, TPD could reinvest time in crime prevention, case clearance, and community engagement. So this slide shows kind of the response infrastructure. On the left, no risk up to high risk. Left side is the current example. So at the highest, we have the crisis response team, and we had a presentation. When the mental health response team was taking through their presentation with us, they alluded to this team, kind of like SWAT. In the low to mid risk, we have the existing mental health response team with the master level clinician and police officer. With no risk or low to mid risk currently, when the mental health response teams from South Cities or Washington County cannot respond, it's our Tigard police officers. So moving to the right, the only real change would be when it's no risk, instead of sending a police officer, you send this first response team. And this is just a summary slide, but really looking at the volume of interactions currently across Tigard that include a behavioral health or transient component is about 20%. We don't have full-time coverage to help these members of our community. We want to avoid potential fatal incidents with people in mental distress and reinvest time into crime prevention, case clearance, community engagement. We also can save a ton of money as a city. And then on the right side is just kind of the recommendation again. So pretty quick, actually, not 15 or 20 minutes, but that's it. The last thing I'll show you real quick is just how I got some of the numbers. This is from the Tigard dashboard, or the Tigard Police Department dashboard on the transparency page. So the green at the top represents all BHI transient calls. Across the bottom is the number of hours in each month, just to show how we got to the 17% of interactions and the average of 140 hours per month. And then if anyone's curious, there are links. I provided links to some of the first response teams for Eugene, Albany, and Birmingham. And the numbers for case clearance come from the FBI's Crime Data Explorer. And that's it. I'll go back up to the recommendation, and if John, if you want to comment on anything as we go, but thank you.
Jeff.
First of all, I want to say thank you, Jeff, to bringing this to our attention. I think it's a great presentation. We need to do something. I think in terms of just behavioral health itself with this pandemic, we see an increase in need for services with the isolation and whatnot like that. As we're coming back and seeing people face to face, it's great to be able to see what the state is also doing around behavioral health. I think this past couple fiscal year, especially this 2020 and also 2021, 2022, we have seen a lot of money going towards behavioral health. I want to say over $1 billion going towards behavioral health, combining those two biennium years. The focus is also really on in terms of services, housing, or workforce. And so to be able to see some kind of recommendation is great. I think it's great. I think we talked about the cahoots back on, I want to say meeting number 11 when Kristen Burke was here. And she talked about in terms of the county did some analysis around the cahoots model down in Eugene to see if this is something that the county itself can mimic and bring towards, bring up here. And what they realized that after they looked at the cahoots model is that the geographic location of the county itself. Eugene is a little smaller in scales. I think they have about 726 square miles, whereas up here we have a lot. We have about 775. I'm sorry. We have. I'm not sure how big Washington County is, but it's much bigger than just the geographic area of Eugene itself. And so they're able to travel in Eugene, traveling back and forth from one side to the other side within 15 minutes. I think important when we look at in terms of a first responder, really in terms of how do we collaborate with all the different areas of services within the county. We have the Hawthorne Walking Center, which is located in Hillsborough. We have Unity, which is the psychiatric beds, which is located in Portland. And then we also have the only detox nearby, which is also in Portland. Now I know that Washington County is building a detox center, and that should be coming online, I want to say probably 3 or 4 years from now. So it's going to take some time to build that. But I do think we need to have some kind of solution. I think in terms of diverting some of the non-emergency call, crisis kind of stuff to the first responder is a good idea. But the question was, where to get the funding and how do we integrate and collaborate with all the other resources that we have within the county itself.
Thanks, John. And two other things that I forgot to mention, and I think we had part of this discussion in the initial meeting that included cahoots. I think one of the reasons Washington County didn't go, another reason Washington County didn't go the cahoots route was potential for risk to basically an unarmed pair. In Eugene, only 2% of cahoots interactions end up needing to call police assistance. So they're really, the calls go through their standard 911 service, and the dispatchers are trained to listen to hear if it's a high risk, medium risk, or low risk. So cahoots is only sent to the no risk things, and only, like I said, 2% of those interactions end up needing to be called. Officers need to assist after cahoots goes. Sorry.
Thanks, Jeff. Before we go into breakout rooms, does anyone have any clarifying questions or comments? Officer Nunn, please.
Yeah, in the population, you said the population was 110. Is that, where did you come up with 110? Because actually Tigard's population is 58,000. So that's almost double what Tigard's is.
Yeah, the idea here is for South City, so Tigard, Sherwood, Tualatin. So it wouldn't be Washington County because, as John alluded to, the scale geographically would make it hard for a team like this to respond quickly across the entire county. But like our South City's mental health response team, they're more centrally located and can get from place to place. So if we could pool Tigard, Tualatin, Sherwood together, again, then that's how you get to 110,000.
Got it. And so this recommendation would be getting Sherwood, Tualatin, and all of us and Tigard. It wouldn't be just a Tigard unit. This would involve Sherwood and Tualatin and those other cities as well.
Yeah, potentially. And I think that's up to the city council and, and the group to vote yes or no. I think Tigard by itself, there is opportunity, but can Tigard foot the bill for something like this by itself, or can we combine? So I think it's up for discussion. Absolutely.
Thank you, Officer Nunn. And Jimmy, please.
I want to commend you for really putting together a very thorough presentation. I just have a quick question, and it is, do you see this being a contracted service, i.e. with a local nonprofit provider, or is it a service that would be become part of the three cities organizational structure?
It could be either. I mean, Eugene runs through a Whitebird clinic, so it is a contract. But we, currently with the mental health response team, it's paid for by the cities and part of the city infrastructure. So, John, I don't know if there's a local team here that does this type of work already, or it would have to kind of be created from scratch.
Yeah, John, go ahead.
I would just want to say, in terms of for providers within the behavioral health field that's contracted with HealthShare, with the care coordinating organization, or with the county itself. So in the contract, I say that the providers are also providing crisis services. So at the end of the day, if they after our calls are being routed to the providers to answer those calls, but also the use of the walk-in center, the crisis walk-in center within Fort Washington County is also available itself. I guess my concern would be just how do we collaborate those different technology structure within the different areas and within the different providers, so that we have a more comprehensive view of the individuals that we are supporting when they're in crisis. So that's something that we have to consider when we look at in terms of a first responder type of structure.
Thank you, John. And Sean, please.
I think I remember that it was contracted out for Washington County, and it might, and the budget might need to include that because they may need access to the experts and resources. Incidentally, John, you mentioned the geographic area. I was just looking, and Sherwood plus Tualatin plus Tigard came out to 24 square miles, and Eugene was 40 square miles. So I think there's some open area, county area between Sherwood and Tigard. So anyways, it looks like it would be a comparable geographic area.
Thanks, Sean. And Commander, please.
Yeah, I just wanted to touch real quick. So the clinician services for the mental health response team are provided by LifeWorks Northwest and a contract through Washington County to include the clinician that works out here in South Cities. So, and that's a clinician that's assigned here all the time. So it is, they may not be with a Tigard officer, but they're out here with a Tigard, Tualatin, or Sherwood officer on there full time. And then during the times when they aren't here, the rest of the county team is available to assist out in this part of the county. One of the things, and John touched on this, was the money that the state has started allocating to behavioral health in the current biennium, and then likely to continue in ongoing bienniums. But to that point, a lot of it, the conversation needs to be around that prevention piece as well, because the prevention is a whole lot cheaper than the reactive part of when someone's already made it to crisis. So that getting the support network in place and that prevention piece is a critical component and that's something that the state is focusing on, that private providers are focusing on as well. But it's a complex network of trying to put that together. So that I wanted to throw that piece out there, that a lot of that money that is coming from the state is actually finally being focused into that prevention area, and that I guess primary care rather than emergency care is probably the best way to put it. So preventative care is always better than emergency care in medicine. And really, when we're talking about behavioral health, we're talking about medical problems or medical challenges, right? So anyway, just a little piece on that to bolster some of the stuff that John was talking about.
And I think that's going to be a good topic for when we go into the breakout rooms too, talking about the trade-offs. Valerie, please.
So I just would like to propose a add-on or a supplemental recommendation to Jeff's recommendation, because I do like Jeff's recommendation. I think it's important, but I also like to suggest that the Tigard City Council consider that our recommendation to the Tigard City Council be that they consider pairing with the similar bodies in Sherwood, King City, and Tualatin to explore the mechanisms of emergency health response, coordination, and funding. Because I think that's the intermediate step to achieve. Because my concern is that, I think mental health response in the South County areas is hugely under-resourced, but I think it's going to take a coordinated response. And I think that there's a tremendous amount of cost savings to be achieved by, I completely agree with what Commander McDonald just said, because I think that, prevention is going to be very important, but it's only part of the puzzle. Emergent response is going to be part of the puzzle. And so we should be able to, allow the police departments of these various jurisdictions to focus on the things that they do best. And part of the charge to this group was to address, situations involving racial equity, where, the question was, is there a response that's not optimizing police resources? Are there things that we can be doing better? And so I think that we had a lot of discussions leading up to this point about city resources and coordinating those things. So I think the next step is not so much in the area of racial equity, although I think those discussions do need to continue. I think the next step is going to be a broader examination of mental health response, in the broader community, and in additionally into the unhoused population. So my recommendation would be that we have a recommendation to City Council to set up a coordinated multi-jurisdictional group to look at this issue.
Thanks, Valerie. And Sean, please.
I just wanted to add on to what Commander McDonald was saying. We've got to think about prevention in the state and across the state. You don't have to look very hard to see that mental health is a crisis in the United States. I'm looking 20% of American adults experienced a mental health illness in 2019. That was before the pandemic. 15% of youth experienced a major depressive episode. So those are obviously not sustainable numbers, and root causes need to be examined. And I think I really like Jeff's proposal, but the root causes and some of these issues need to get addressed at a state level and a national level.
And I do want to remind that this group does have the option to ask the city council or ask the city to lobby at the state or federal level for some of these solutions. So that is something that is within this board's purview per your charter. So with that, I think we've got some interesting questions to consider going into the breakout rooms. Jeff's original proposal, as well as Valerie's additional one, as well as some of the trade-offs with investing in prevention versus once folks are already in crisis. So we will go into the breakout rooms now. We'll be there for 30 minutes. So we'll be there through 6:15. And then I'm going to ask when you go to the breakout room to select somebody to report back out for the group at the end. So we'll be back here at 6:15 and continue the discussion.
I'm going to jump off now.
Okay. Thank you for joining us.
Thanks. Bye.
Enjoy the budget meeting.
Mhm.
Alex, thanks for putting up the slide. I think we got everybody back. So Danny is speaking for our group, and then
John is speaking for our group.
who is? Sorry,
John is.
John is. So Danny or John, whoever wants to go first.
Sure, I take it. I go first. That's fine. We talk about in terms of, we know that this is a broken system, and this is what we believe is more a societal problems, and what we need to really look at in terms of what is failing with the current model, and not look at this as more of a moralistic type of reaction, but more in terms of you need to look at this as a public health system, and it's not a criminal system. There's a lot of police intervention around matter of crisis, and there needs to be the right pairing. I think we got the MHRT. I believe someone in our group mentioned that the chief looked into the different model, the CAHOOTS model and MHRT, and they went and decided to move towards the MHRT model. So it'd be great to be able to get some of the feedback from the chief around why didn't she go with the CAHOOTS model per se. We talk about in terms of the conversation that Commander McDonald made about prevention. And I was saying that I believe we need to do both. We need to look at the prevention side, but also parallel with in terms of what we do in the interim right now with some of the challenges that we have within our city. And I want to say again, thank you for the proposal. I think it's a great proposal when we look at it. I think in terms of when we try to pair it with the South cities, which is Tualatin, Shorewood, and Tigard, there's going to be some challenges. And so that being said, I think we need to do something, right? And what makes sense for us and what makes sense for law enforcement. I think Valerie made a proposal in terms of looking at bringing the three cities together and start to talk about awareness and the concern of exploring the need for funding. Maybe talk about the charter, maybe talk about who's in charge. And also there's a discussion to bring in Washington County into the discussion, because Washington County is in charge of the public health services within the county itself, especially with the county having contract with the walking center, the crisis walking center, and so forth. So I think we agree to something needs to be done. And maybe the first step is we still look at the proposal, but I think the first step is maybe look at bringing the three cities together and have a discussion. Hopefully I capture everything.
Any other comments from the group? All right, Danny, go ahead.
Yeah, I think John's last point is a good segue in that we all came to the general consensus that we had to have some other intermediary response that would be part of a hierarchy of responses, but we need to get more people involved and included in this conversation, that it's not just at the city level, but would include Washington County, like John's group said. And we also had a conversation around including TV FNR as a body that's already consists of medical experts. And so why not leverage and expand what they're already doing to address this problem in collaboration with Tigard, Tualatin, and Sherwood. And some of the other points that we discussed was the importance of including bilingual, bicultural competency in the personnel of whoever would consist of this team, just given the lack of that in the state, especially for Spanish speakers. So yeah, just kind of in conclusion, we just all agreed that Jeff's recommendation is great, and it should serve as a jump off point for further discussion with these other organizations, and maybe what might come out of that is another similar type of committee like ours here, but that would, take that recommendation and try to bring it to fruition. And so that eventually led us to an amended recommendation. If Kim wants to share that, that states the recommendation is we work with other local jurisdictions to establish a Tigard or South Cities mental health response team to serve community members. Blah, 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 blah. The rest that's the same, and then added to include multilingual and culturally competent services. And then the other amendment was the goal of this recommendation is to, that wasn't really an amendment. But the end is, the recommendation serves as a starting point for conversation between the city and county governments in South Washington County and Tualatin Valley Fire and Rescue about the future of mental health response in the region.
Valerie, please.
So one of the things, so we added TVF&R because one of the things that really strikes me about this is that they are present in all of these communities already, and so, if someone calls with a medical issue, they would be uniquely sort of situated to address the medical issue. So I think what's the only thing that's really missing is the counseling part of it. So I just wanted to mention that thought in response to the, addition of TVF&R.
Thanks, Valerie. Anyone else from the group have anything to add?
One thing our group said is this was not something meant to cut police or take away police funding. This was an add-on to cutting anything.
And it's not really, my guess would be that the group, whatever the group that gets together to talk about this, would address funding sources, right? Because there's going to be local funding probably, but also there's quite a lot of funding at the state level and potentially grant funding for something like this.
So what I hear from the two groups is largely consensus around the idea of expanding some sort of mental health response in the region. And John, please.
I like the idea in terms of what you typed out in terms of the recommendation of bringing this group. From my perspective of what my understanding and my history and learning is that it's also great to bring in terms of people who have lived experience, people who had those crises, who's been in crisis and what works well for them, to be part of the discussion and just not the government staff and so forth.
Great idea.
Jimmy, go ahead.
Yes, good work on the rewrite. The statement, work with other local jurisdictions to establish. I feel really comfortable that we not say to the other jurisdictions and or to Tigard that we are establishing this particular mental health response team, but that we determine the efficacy of establishing either a Tigard or a South Cities mental health first response team. I think by establishing a committee that is inclusive of representatives from the different cities, representatives from the public health organizations, meaning Tualatin Valley Fire and Rescue, the local public health authority in Washington County, as well as any public or private partners that could be brought into this, as well as community stakeholders. Makes a lot of sense in terms of having something like what Jeff has put together as a jump off point. So it's not the end all to be all, but it is a place that says, hey, you know, we think this is something that could happen. It may not be what we all come up with. It may morph into something else. But the most important thing is that we have a conversation that begins to describe, you know, what our local communities need as it relates to mental health first response.
Yeah, and I think, Jimmy, a way to do that is to change this word establish to explore.
Yeah, that's good.
Unless Valerie feels differently. Okay, then we'll just keep going in order. Sean, please.
I agree with Jimmy's comments there. We currently have a system in place already with MHRT. We could add a recommendation to increase funding for that and as an interim solution while this other option gets explored.
It's a good thought. If anyone has others, and Commander, please.
So now everybody's got my juices flowing on the thought process here. And my group knows, and then I know John knows because John and I have had these conversations before. So knowing that in the current state biennium, there is a significant amount of money that has been put forward towards behavioral health and specifically mental health wraparound support services. I'm wondering if there should be something in here or maybe a separate recommendation or something like that where we talk about part of the charge of the board is that advocacy potential at the state level, and maybe something that could go into that would be something talking more about that support work that is a part of that is such a critical piece of that, but that's such a big piece. I mean, big meaning it's so much bigger than Tigard, right? I don't know. Now I'm just I'm shotgunning a little bit here because I'm passionate about this topic, and I really do feel like in addition to being just local and with the county that there needs to be some sort of I don't even know if it's a recommendation, but maybe some sort of a advocacy to show the support of this community at the state level for continued funding for behavioral health or for mental health services, something like that. I don't really know exactly how to word it, but it's something along those lines. I mean, that is part of our responsibility, right? Is to try and make some recommendations maybe to city council to where they could advocate for things that would not only be supportive of this community, but maybe at the state level and statewide, right? And this is a statewide problem. It's a I don't know, it's probably worldwide, but for sure across this country, we see this consistently. So, okay, that's my thought process for that idea. Just because I feel like that's an important piece of this you know, the solution for this is to have something at the state level. So I'll stop now.
Valerie, please.
So a couple of things. So I think what when the city council has adopted resolutions in the past, there's usually recitals that go at the beginning of them where they take notice of things leading to the recitals. Or leading to the recommendation or the action that they're taking. And I think the city council taking notice of the fact and you know, 19th century lawyers would use the whereas, you know, there is a current mental health crisis in this area. And whereas, you know, there's a whole lot of different things that go into that. But I see what you're saying, Commander, and I think that everybody on this call realizes it's a really complex issue that has a lot of really challenging conversations that need to happen to find a good, efficient, effective response. But to get back to the one recommendation, because I do support what you're saying, that we need to put mental health as more of a priority in this area. But to get back to the recommendation, the reason that I was hesitant when you started editing the language at the top is because I think what we need is a jumping off point that has a mandate of some sort, that has here's what we think probably needs to happen, or an aspect of things that we think probably needs to happen. And that's why I like the word establish better than explore. Because I think, no, I don't want to.
Oh, it's just there for discussion. It's not there as a permit.
So, I also don't like and or. So if they ever try and insert an and or, I'm going to object. But because I think it's important that we say, here is something that we think we've identified, that Jeff has identified in this presentation, that is working in other jurisdictions that might work in Tigard. And so then you get the people to the table and you have a discussion. They can evaluate, is this something that is right for this community, that is, addresses that lower tier of response. So that's why I like establish better than explore, because I think explore can lead to a lot of navel gazing. And I'm constitutionally opposed to people sitting around talking about an issue as opposed to not doing anything about the issue. So.
It's a good point, Valerie. And before Sean goes, I'm gonna name something that we've seen in this group. Is there's often been a point in these recommendations where we go between, are we investigating something or are we asking for an action? And that is, you've gone both ways as a board on how you decide to use that language. So either one would kind of fit with the precedent of this board. It's really kind of up to this group, and we might have and I would appreciate more folks kind of weighing in on how you feel about this recommendation, establishing or exploring. And Sean, please.
It almost seems like the recommendation is establishing some type of committee, regional committee that explores this, and that will end up likely will outlive the Public Safety Advisory Board itself. And the other thing I'm wondering about as I read the entirety of this is, a lot of people looking at this would probably go, well, how does this differ from the current program MHRT Washington County is already doing?
Yes, I'm sure there would be any number of confusion, but I think folks who are familiar with MHRT reading this recommendation, it does have a different flavor to it. Jeff, please.
Yeah, and just to clarify, Sean, the main difference would be this group only responds to no risk situations where the existing MHRT with the officer and the clinician can respond to potentially higher risk situations. The other thing is on the clinician medic pair difference between the MHRT clinician, that's a doctorate level person, where the social worker or mental health person on this first response team wouldn't necessarily have to be have a doctorate degree.
Makes sense. Another thing I wanted to add, it would be nice to see an advocacy portion of this where we're empowering the city of Tigard to, on behalf of Tigard citizens, ask the state for help in resources for mental health and for education. We should not be last. The state of Oregon should not be last in funding and resources for education and mental health, because it creates a cycle and it creates a societal problem. And I think it's fair to ask that question.
Yeah, I think that goes back to Commander McDonald's suggestion as well. And Valerie, please.
So one thing that occurs to me is, when we talk to City Council about this, or when Patty talks to City Council about this, which I hope she'll be able to do. It would be nice because I really like the slide deck that Jeff put together. And so to have this accompany, a recommendation from this group, I think is important because it gives the context of our discussion without making them wade through hours and hours and hours of our deliberations. And it would start off, it would also be useful, if they do decide to establish a committee that would last beyond this, our group, which, we're set to end next month. If they were able to say, okay, well, here is some very good information that's been pulled together, and we can use this as a jumping off point for those conversations.
Yeah, that's some great feedback. One of the things, I don't know if you guys have seen, I know it gets published in the city council reports, is we take the recommendations and there's a template that we use to distribute to city council. And what I'll do for this template, if this goes to a recommendation from the board, is package Jeff's original slide deck with that recommendation, so they get all of it together. Commander, please.
Yeah, just a quick point of clarification. So the MHRT clinicians are master's level clinicians, and while there may be some doctorate level folks there, they're vastly master's level clinicians. So I do know that the Cahoots model does, use some people that are not yet master's level clinicians. They have some that are working towards that, but for MHRT, they're master's level clinicians largely.
Thank you, Commander. So I don't see, oh, I see one more hand. Sean, please.
Sorry, one last thing. Somewhere in here, I want to be considerate and respect city management and the police departments and the agencies, their obligation to consider risk of sending clinicians out on unarmed calls. The Cahoots model is very successful in that. I think I read they haven't had an injury in 30 years or something like that. So they clearly have figured out some keys to success. And I also think it's very difficult to set up new organizations. So anyways, we certainly don't want to be in a position as a community where, we start this program and then quickly, as Seattle learned, find our clinicians being, stabbed, injured. We've got to think about the safety of themselves and their families. And anyways, I think this is a great idea. It's a great proposal, but certainly I think we want to be respectful of, the city and the experts, risk management, their perspectives.
That's a good point, Sean. I think we can add something maybe in this sentence with a focus on service, provider, safety, care, and providing resources, if the group is amenable. Commander, please.
Hey, Sean, one of the things I think that would be, it'd be a critical component of the creation of a position like this would be to delineate what types of calls they would respond to. So what I would envision in something like this, and knowing some people that work for the Eugene Police Department and the Springfield Police Department who have that firsthand working relationship with Cahoots, they have a really well-defined guideline of what they'll even be dispatched to, the Cahoots members. So when it's within those guidelines, then they'll get dispatched, and law enforcement does not get dispatched. So we would have, I envision that there would be something very similar to that that we would have. And so the dispatchers would be trained in that, that evaluation, so they would be aware, and with the whole goal of the fact that we wouldn't even dispatch that team to those types of calls. So let's say, for example, we get a suicidal threat call. Chances are that would be a police officer response, and probably MHRT. So you would have a clinician going with a police officer. So you would be much less likely to put that clinician into harm, or put a team like Cahoots, let's say, in harm's way, or a first responder team that doesn't include a police officer in harm's way. specifically based on the call type and the training that the dispatchers get to evaluate the risk of that call. So I would envision that being something that would be a part of the creation of this program and this plan and these positions. And so that ideally those folks wouldn't even be dispatched in those types of cases. And I think that to your point about Seattle, I think Seattle tried to put too much on those teams initially. They created a really high bar, and they were, quite frankly, being dispatched to calls that I think that if we all were to evaluate those, we'd say, well, why wasn't a police officer dispatched to that? Because this person was expressing violent behavior, potential access to weapons, things like that. And therefore, those, I think that all of us could agree you would want to have a police officer, somebody who's specially trained, maybe responding with a clinician like the MHRT model, so that you would have someone that could help from the mental health angle, and then someone that's been trained in dealing with someone that may be a violent threat as well. So that's how I would envision something like this. Is a lot of it would be taken care of through the training aspect of it. So
I think it would be great to have, similar language with what you just said, Commander, in here. Particularly since this recommendation will outlive this board in our discussions, and we won't come back to it most likely.
I think one of the things about this recommendation is it's not very prescriptive when it comes to exactly how implementation. It's similar to a lot of our other recommendations where it's been kept more at that concept level. So I'd like to urge the board to stay at that concept level, kind of in keeping with some of the other recommendations that we've done together. We do still have one more question that's outstanding before I'm going to toss us back to Patty, which is this difference between explore and establish. We've heard from two folks on the board. This is really a decision of your guys. So does anyone else feel the need to weigh in? Do we want to do a thumbs up?
I'm comfortable as I continue to look at this. I'm comfortable with the concept of establishing. I do think that, and I've certainly been in enough citizen and community process to know that we could endlessly go on into discussion, and I certainly, don't have an issue with having folks engage in conversation of such. That being the case, I think if we go forward stating something obvious, this is something we want to do, or this is something we see needing to happen, that I think that presents a little bit more critical dialogue focused toward city council. So I'm comfortable, excuse me, with having the wording reflect establish rather than explore.
Anyone feel strongly about going back to explore?
I'm comfortable with establish if we could get some language in there that protects the safety of the future folks that will work on this program.
And again, I think the best place for that would be with a focus on service, care, and provider safety in this sentence. Anyone feel strongly? Okay. Patty, we have a recommendation on the floor right now.
And so at this point in time, Kim, would you like to,
If you would like to entertain a motion to vote on the recommendation, you'll take a first and a second, and then we can move, ask for any further discussion, and then we can move to the vote.
Valerie, did you have something you wanted to say before we move on to the vote?
No, I wanted to move that we adopt the motion before the.
Thank you, Valerie. Is there a second?
A second.
Seconded.
We have a motion and a second. So Kim, are you going to take the roll?
I will, as long as there's no other discussion. Commander McDonald.
Hang on, I wanted to read through and make sure I understand it comprehensively. So give me just another 30 seconds here.
Absolutely. Got to know what you're voting on. Judge, please. Oh, Judge, you're muted.
Just in terms of wording, putting provider safety and providing resources right next to one another grates on my ears a little bit, but it's not a critical thing.
And Shelby?
Maybe offering resources. Doesn't matter. It's not a big deal.
Shelby?
So I didn't feel strongly about it, but I did have the same grade on my ears that the judge mentioned. I also do want to clarify. So Jamie's last point, and it sounded like there was consensus around it, was that for the provider safety, this team wouldn't respond to violent calls. So the third line says violent calls. Okay.
Yeah. Non-violent.
Oh,
it's just a bad.
That's okay. That's blocked on my screen. All right.
Oh.
Thank you.
Non-violent.
Perfect. All right.
And Sean, please.
It looks like we left suicide threats in there, and that may need a police officer to be there for safety.
Valerie, please.
I think that that's not a prescriptive list, so I don't think it's a problem. My expectation is that any discussion would limit the scope of care and would also address the, sort of where the risk factors are. But I think that's a good point, Sean. But I think that there are standards of care that Cahoots has established that address a lot of these issues that you've raised.
That's a good point. Suicide threats is also a very broad category.
I think if the program lands similar to Cahoots with the city and agency's guidance and discussion, I was just saying that this discussion is going to outlive this board and our discussions by a long ways. So I just want the language to be clear. That's all.
Thank you, Sean. And Commander, are you comfortable going into the vote?
Yeah, and I did want to just hit one thing. This is something that the chiefs and sheriff they have a regular discussion about this topic of what does this look like moving forward, and is there a moderate point? So I just so that everyone knows, I think that the chief will actually feel really comfortable with continuing on a conversation about this, because this is not new in this this concept. I think that some of the language we've included in here, some other partners, is a little newer, and I think that is valuable. So I will say yes, I'm ready to move forward. So I guess, Kim, if we're ready to move, I've now read through it and I feel good about what's there. So
all right, then Commander McDonald.
Yes.
Yes. Officer Nunn.
Yes.
Shelby Rahala.
Yes.
Michael O'Brien.
Yes.
John Trin.
Yes.
Jimmy Brown.
Yes.
Patty Lofgren.
Yes.
Justin Lowe.
Yes.
Danny Rauda.
Yes.
Valerie Sasaki.
Yes.
And Sean Stoldrayer.
Yes.
Great. With 11 votes, it has passed unanimously. Congratulations.
Thanks again, Jeff.
Yes. Thank you, Jeff.
Thank you so much, Jeff.
And as promised, when I write this up into our template that we use, I will package it with Jeff's PowerPoint slides so the full context is captured.
Thank you, Kim. All right. We have just a little bit of time. Are there any particular current events within the city of Tigard that you would like to discuss at this point in time?
That's okay. I have a couple topics for the group. So looking at our next meeting, there are a couple of options before we kind of go into a couple of our wrap-up sessions. So one is discussion around officer appearance, which had been requested previously by the board, and we can have a presentation ready for the next meeting. We also have this discussion, there could be a recommendation around asking the city council to advocate for statewide, state level resources. And there has also been a thought that there may be more group discussion or desire for group discussion around the community navigator position, around what exactly the intent would be and kind of fleshing out more of what that role could look like. So those are the options for the board for the next meeting. I wanted to put those out there for this discussion. And Danny, please.
Sorry, I couldn't find my screen. It disappeared, so I couldn't find a way to raise my hand when you were saying about current events in the city of Tigard. So as I'm sure many of you know about the car accident that happened in Beaverton. Was it last week already or 2 weeks ago? But the crash obviously happened in Beaverton, and the students, an officer were from Beaverton, but the students that died were members of our parish at St. Anthony's. So we've been trying to organize some kind of response, and we are offering a grief and loss workshop for teens and parents and adults. And anybody is welcome to come. They don't have to be members of St. Anthony's, and it's not specifically faith-based, but it's just more general kind of support, tools, information for people who have had to deal with death and loss, especially at a young age. So the teens obviously focus more from a youth perspective, but the adult workshop will focus on how you help young people navigate this. So I just wanted to share that. And if anybody is interested, they can contact me. It's on May 17th is the adult version, the adult option, and then on May 20th is for youth.
Danny, would you mind sharing that information with Alex, and she can send it out in our PSAB email? It goes to the street. Thank you for sharing. Valerie, please.
Well, a couple of things, but what, you have that list of topics for us to talk about. And one of the things that I've been thinking as we wind down the activities of this board is the what's next aspect of things. And so I think a good place to start that might be with some additional discussion of the community navigator position. I know we talked about officer appearance, but I don't actually remember what we had talked about discussing in the context of officer appearance. So I don't care what the officers look like. I mean, diverse officers is certainly going to be a good thing, but beyond that, so that would be my suggestion.
Thank you, Valerie. And John, please.
Yeah, I just want to just remind everyone and the community that the farmer market is open. It's open May 1st, and it's going to be here through the fall. It's from 9:30 to 1 o'clock or 1:30 on Sunday. And I think the PSAP board is also have a table. So I encourage folks on the board to sign up for that and talk about the PSAP.
Thanks, John. And Officer Nunn, please.
Yeah, I just wanted to ask Danny if he had any information on services and or the class you had for youth, if you could pass that on to me. I have contacts at Southridge, and then I have several students at Tigard High that were friends with the kids that were killed, and they've asked about resources and when any services or memorials were for them. So if you could pass that on to me so I could pass those along, I'd appreciate it.
Will do.
Sorry, Officer.
Kim,
Yes, Sean.
I also did have a ton of interest in the officer appearance discussion. I think I can.
You did or did not?
Did not. I think I can trust the chief to handle that.
Yeah. I think it's more part of the national narrative. All right, well, that's good to know. So we will instead plan to have more of a conversation around the community navigator position and kind of fleshing out more of the details about what that could look like for the city. So we talked about in our breakout room is that one of the goals of the board is to identify gaps that are that exist and how to address them in the community navigator position. I know from our previous conversations is something the board is interested in using to fill those gaps. So that's great. And then for our last two meetings, the first meeting in June is that closing what's next. The chief is going to come with a proposal about what she sees as kind of the next step of PSAB and how she's going to continue to talk with the community and get community feedback even after the PSAB has concluded its business. And we'll be having a discussion around that and taking any of your feedback. And then we will have a closing meeting, a reflection, and the second meeting in June, where we'll talk more about your experiences. You also will start seeing a survey from Tammy and I probably in the next week or so. You might recognize some of the questions from those first interviews I did with everybody. And now it's a year and a half later. Want to get more feedback on your experience as a board member and as a part of this city kind of experiment. What's worked, how you felt during it, and things that could have gone better as the city looks and explores more community involvement activities. Jeff, please.
Maybe as in preparation for the what's next part of June, it'd be awesome. I know that the city council gets updates on recommendations and what's happened, but it'd be awesome to just get a list of what the board has voted on and kind of what the status is, whether it's like implemented, like the body camera recommendation, or things that we're still working through.
Yeah, I think it would be good just to have that list in front of all of us too, and remember what we've done over the last year and a half together. And I think that wraps up my next steps, Patty.
All right, and there was after we heard from Mr. Potoff, would you please post Alex Richardson's address in case any other comments that board members would like to make? Kim is going to post Alex's email, and those comments can go to Alex. And then I believe Alex is going to send out Annie's workshops. That's really good information for all of us. Thank you, Kim. All right. And at this point, is there anybody who would like to call for a motion to adjourn?
So moved.
A second.
Second.
Any further discussion or opposition? In that case, our meeting is adjourned. Have a great rest of your evening, everyone.
Good night, everybody.
Night, everybody.
Good night.
Good night.